The following program has been pre-recorded, so please don't call in at this time. If you wish to participate in the program, tune in at 5 p.m. every Wednesday for A Pause for Thought on Baton Rouge Community Radio. Good evening, fellow humans. This is Wayne Parker with A Pause for Thought, coming to you on Baton Rouge Community Radio's only live call-in show so far. We're at 96.9 FM, WHYRLP in Baton Rouge. And yes, you can call in, and you are encouraged to do so, and share your thoughts and insights on whatever topic is being discussed during the show. The only rule is that you state your point as an opinion or suggestion in a respectful manner. Anyone who tries to turn this into a rant show will be made to, let's say, go away. Anyway, we have Dr. Tom Hannie in the studio with us tonight, along with my regular co-host, Johnny Parker. And we're going to join them, start the interview slightly in progress because of the incompetence of my recording engineer, that is, me. So anyway, here we go with this evening's A Pause for Thought.
I focused more and more on forensic work as I got older until in recent years that's the only thing I did.
Okay.
Just a lead-in question for you, Dr. Hannie. I read that you started out as an engineering student before you pursued your degrees in sociology and psychology. Could you give us just reasons maybe why you made that move and how maybe engineering as it first appealed to you, how it may have had some tie-ins to your later work?
Well, if I look at my skill set, I was really better at mathematics and physical, the sciences. And I finished all the work I had to finish in that field. After that, however, when they put me on the drawing board and in the shop doing stuff, I just didn't like it, didn't find it a lot interesting. So after a little time off, 2 tours of duty in the service and a little all-wheel rig work, I decided I got interested in psychology, so I went back in psychology. And the way that shaped what I did is it was my preference for the objective and mathematical approaches. So rather than getting caught up in all the old-time Freudian stuff and Rogerian, well, how do you feel about that? I was much more interested in the objective, the demonstrable. And so it made me a natural, after finishing my degree in clinical psychology. I got my bachelor's at LSU and master's and PhD at University of Georgia. And that was my minor area was in sociology and in industrial organizational psychology and statistics. It was easier for me to go into the more objective fields, areas of psychology.
Could you tell us a little bit about some of the different work you did early in your career? I understand you actually taught some, you did some teaching, you did quite a bit of clinical work with drug rehab, inpatient, outpatient work.
My goal was to be in clinical practice, and I felt like I had to be able to at least recognize everything. So I was trained in some in neuropsychology, in the broad field of clinical psychology. I worked with drug rehab facilities to some extent. I worked in preschool. I worked in the schools. I worked with executives at the very highest level, including the boards of directors of the big oil companies, the head top people in the big churches in the United States, and a lot of, all the way through all levels, and the regular clinical work. And but my real goal past that was to go become work in forensics. I also did some work in the jails, the facilities for the criminally insane, they called it. So I wanted to get a broad view, even though it's not what I wanted to do. I wanted to be able to deal with it when I came across it, and at least recognize it to the extent to get it out to someone else.
Was there any one particular aspect of forensic psychology that really interested you, as opposed to the clinical environment, clinical application?
Well, even when I was an undergraduate, I did a little work at what is now called the Feliciana Forensic Facility. And during graduate school, I worked there some during the summers. The criminal fascinated me. Then when I got into practice, I got very interested in chronic pain, and this was always going to court. And over time, I increasingly was getting referrals and got much more interested in working with people who were claiming they were in pain. And where that ties in is that these people are going to go to court at some point. When someone goes in to see their physician with a busted back, or they're claiming a busted back, somebody wants to know, why is that happening? And when somebody's getting paid to have pain, be it they're going to get paid for workers' compensation, or they're going to get paid in a lawsuit, they start claiming a lot of pain that the physicians can't find. So I increasingly became referred for that reason, and I really found it fascinating.
How do you do that? How do you figure out if someone is really hurting or not?
Well, we know what people look like, act like, what they say, and how they complain if they have back pain, for example. We also know how people that fake what they say and what they claim. And so we have norms, and, we learn about it, and what are they going to say, what are they going to claim, and we have developed tests where we know that one of our tests I can recall, they did dealing with the emotional problems that come along. They sampled hundreds and hundreds of cases and found the highest complaint level was, as I recall, a 67. So 72 is a cutoff point. If anybody got above 72, they were likely to be lying, because nobody we looked at that was telling the truth, that wasn't going to get paid for their pain, would report over 67, and we'd get scores over 100. The people would come in, when they're trying to embellish, they make many more claims. But that's just one way. They don't really understand. The people not in pain don't know what a person in pain is going to say and how they're going to describe things. So, we learn about that, and we look at it from that direction.
It sounds a lot like just regular detective work, or another type of detective work, where you gather a whole bunch of information and find the common thread or find the anomaly or something like that.
That is a huge factor in forensic work. If I saw a patient 4 or 5 hours for, good, strong, a clinical interview would be anywhere from 3 to 7 hours typically. But I spent a lot more time than that tracking down records. I wanted to see what was going on and why, and how many times they lied to me.
Okay. I'd like to remind the audience, since I didn't tell them in the first place, you can call in and share your comments and questions at 343-9927. That's 343-9927. You're listening to Dr. Tom Hannie, a psychologist, clinical psychologist, you said, right?
Yeah.
Okay. Here on A Pause for Thought, if you're live streaming and you're outside the calling area, you can dial the area code 225 and 343-9927. Okay, Johnny, you had some more?
Just to follow up, Dr. Hannie, about how do you determine if a person's lying or not? What are some of the typical battery of questions that you might look at or other psychologists look at to come up with that score of 67?
Well, that particular score is on a particular test. the structured interview of reported symptoms. But that's just one. We have dozens of tests that are very good at detecting if someone is lying or telling the truth. There's one test where people look at pictures and then try to remember what they saw. And sometimes, a lot of times, somebody who's faking will score less than chance. They'll score worse than if they were throwing a dart. It's obvious they remembered because they remembered well enough to avoid answering correctly. And we have just a lot of huge battery of those. It's of interest that the Social Security Administration will not allow psychologists to use these tests. They don't want to catch people faking.
Oh, great.
Dr. Michael Savitz said that he did a lot of work on faking in this area, and he came up with being able to show that we're paying out tens of billions of dollars every year to fakes.
Okay.
And what we wanted to do was to have, because when someone, the cost of people with emotional problems drawing Social Security is huge.
Right. Now, I want to keep it focused on you and forensic psychology and clinical psychology. I don't want to get into politics here because I understand how you feel, but and then I agree with you to a good extent. But
well, the basis of when you're doing forensic work, as they told me in graduate school, if we believe what a patient tells us, they're going to come take our degrees away from us. Patients don't tell the truth. I mean, somebody's drawing $3,000 a month if they're in pain, but if they're not in pain, they're going to have to go back to work. What do you think they're going to do?
Well, okay, well, we're doing politics here now.
Well, it's not politics. Yeah, I understand, but when I am sitting in that chair, having to make a judgment.
Yep.
That is, I have to take that in consideration.
Right, I agree. No, I totally agree with that, and you are absolutely right. And I'm well aware that people will lie for money. It's that's just a fact. So, what are the percentages of being correct?
Of being correct?
With you, if in judging someone as lying or not, is there a percentage, or are you pretty sure?
I'm basically, when I'd made that call, I was the last person to make the call, so it's hard for me to tell. Since eventually, I guess I'm the one that's making the call.
That's it.
I didn't make it lightly. I would have to see in the records that there was some discrepancy. I would have to see that what the person was telling me. I would have to see objective data on my tests and I'd have to be comfortable for my interview that the person was not telling the truth. But the fact is, that was the biggest part of my job, is to make that determination. Is this person telling the truth? Because when they come to me, they didn't get to me until they had seen a lot of people, and a lot of people had said, well, this person's got a problem, but we can't find it physically. We look at all our MRIs and X-rays, and everything we look at, this pain doesn't make sense. And it was up to me to make the call. Is this person having an emotional problem? Say they were injured in a wreck. It could be the result, the pain could be the result of something like PTSD. Where they were traumatized by the wreck, and they would need rehabilitation, and I would refer them to get somebody to treat the emotional problems that resulted from the wreck. But they would not be able to say it or understand it. They expressed it in terms of physical pain. Sometimes they would have real emotional problems when they came in. It would then be my job to track back and see, was this an emotional problem that pre-existed the accident?
Mm-hmm.
Or is this something new? Or are they telling an untruth? Or are there other factors in their lives that are causing this? Is this person, that's, for example, a substance abuser? Are they saying they have pain? Because when you say I have pain, somebody writes you a prescription for a painkiller.
Mm-hmm.
And somebody can be addicted on painkillers, and that can be the motivation for them to have complaints of pain. What they had in common when I saw them was they were complaining of pain, or they were complaining of an emotional problem. And that's what it was my call, my responsibility to determine where were the complaints coming from. And to a very large extent, I mean, we don't have this problem when somebody comes to us voluntarily and says, I need help. They have, very little motivation to claim, although sometimes they do have other factors. But when they're getting paid is when the forensic psychologist comes into play, and the forensic psychologist has to deal with that.
And you're paid to make sure they're not lying. So
I'm paid to make the determination. Now, as far as my pay is concerned, it does. When I'm seeing a case clinically, somebody comes to me, they've got a clinical problem, my responsibility is to that patient. I am there to help that patient, to do the best I can for the patient. Sure. What they tell me I believe, and I try to help them. When I am hired, it doesn't matter who pays me. When I am hired to do a forensic job, my responsibility is to help the trier of fact, be it a jury or a judge, to give them maximum assistance in coming to their final conclusion. I express my opinion, but that's who I am responsible to, and I have to be as objective as I can.
Okay, now on that point, sorry, Johnny, you mentioned that when you're treating somebody privately, they're paying you. If they tell you something, you believe them. What if you don't believe them? What do you do then? I mean, what if in your best interest for them, they're lying to you, or they're handing you a con job about their problems, or dealing what they're doing to themselves to solve it?
Well, a patient coming in, they don't always know exactly what's bothering them, and it's my job to help them get to understand where their problem is. And I might confront them on some issues. I might do some testing to determine, and if I find that they're grossly over-exaggerating, I have to deal with some amount of hypochondriasis or symptom exaggeration.
Mm-hmm.
That's not unusual. But it's a different issue when somebody's being paid to have symptoms, and my job is to make the determination.
Right.
I am working for the judge and the jury,
mm-hmm.
and it's up to me to be as balanced as I can be. Now, in my role in working as a forensic psychologist, I've been hired on some cases to help one side win. When I'm hired to do that, I cannot get on the witness stand because I'm biased. I'm hired to help somebody win, and I'm to help somebody get around whatever's going on in the courtroom. So I have a different outlook. But at that point, it's not ethical for me to get on the witness stand.
Sure. Now, on that point there, you'll be working in the capacity of an assistant to the attorney, I guess, to consult with the client or the person charged and tell them what to be careful of and things. Okay. Again, I want to remind our listeners you can call in and voice your own comments and ask your questions at 343-9927. We're speaking with Dr. Tom Hannie, who is giving us a lot of information about his experience as a clinical psychologist and dealing with various types of people.
What I'm hearing so far is that the work you've been doing or have done in the past in terms of the workman's comp has a tremendous impact on the cost of our society, the cost to our society, the cost that we all pay in terms of not only money but in terms of productivity. How about can you tell us a little bit about some of your work in forensic psychology and the criminal system in terms of of that area?
Most of my work in that area was with people who were deemed incompetent to stand trial. If you are, there's a long list of questions that have to be answered when someone is not able to stand trial. They don't understand what the proceedings against them. They don't know right from wrong. They are unable to assist the person, that's the attorney who's helping them, and I would be called in. I had a state contract to go to the prisons to look at the people who had been determined incompetent to stand trial, to see was this really the case. Now, the problem when I started doing this was that a physician was licensed to make this determination, but a psychologist in the 1980s could not make that determination. So what would happen is your local, many of them were done by gynecologists, internal medicine people, and that's OBGYNs did a lot. That's not an exaggeration. Then we got the law changed, and there was a big jam of cases waiting to go to court because so many were determined to be incompetent to stand trial. So I was hired, and I went out into the community, into the jails around the state to try to clear up that backlog. And I found roughly 50% of the people who were determined incompetent to stand trial to not be incompetent. They, many of them, they had emotional problems, but they could stand trial. Many of them were just plain old faking. I mean, they were just blatant faking. When somebody's been convicted of 2 crimes and they're looking at the 3rd crime, they're going to do anything or say anything. And it was my job to go out there and say, okay, this person is competent, this person is not competent. I was hired not by the state prosecutors, but by the State Department of Hospitals, because it was their job to rehabilitate the person. If they were not competent, they had to rehabilitate them and get to the point where they were competent. So again, these were people that were motivated to act as if they were not competent.
Okay, I got a question about determining if they understand right and wrong. There's an understanding of what society considers right and wrong, and then there's the person's understanding of what's right and wrong. As an example, there are a lot of people who don't think they should be prohibited from smoking a certain weed, and so they do it anyway. But a person, because of the way his mind works, if he really truly believes that the crime he committed or crimes he's committing are not wrong, but he's aware that society thinks they're wrong, he just has a disagreement with them. What is that?
Well, here you get into behavior specific. What offense did they do? What are they accused of? If a mentally retarded man, say, was hit somebody in the head, did he understand that was a behavior that was not appropriate and it was illegal? Now, one of the things that they try to teach in habilitating the mentally retarded, a higher level person, might be how to write a check. Now, if somebody convinced them to write a check and they had an account and they wrote a check that was a bad check and they cashed it, would they understand that was right and wrong? The same person who might know that it was wrong to hit somebody in the head with a hammer might not know that it was wrong for them to write that check.
Interesting.
So, that gets into the Supreme Court ruling that really made me, it was just a horrible ruling, that if you're competent for one thing, you're competent for everything.
Whew. Yeah.
And that it came down from the Supreme Court, and all I can do as a psychologist is live by what the Supreme Court says. I point out what it is, and I hold my nose because I'm a citizen before I'm a psychologist, and I have to live by the law. But I write my report based on what I think and what I find objectively, and I have to let it go with that. But, that's silly because somebody, and this competency thing gets really interesting when somebody, they may be extremely crazy and not have a clue, but if they are and they own a bunch of stocks and they sell them, nobody goes back and say, wait a second, that stock sale you did is void because you didn't understand.
Yeah.
However, if they write a will, then the will might go down or might not go down. And by the way, that's one of the things that I've done in my career. And when somebody wants to write a will and they have pretty good reason that it's going to be contested, a lawyer might call me up to go in and examine the person. And I will be there when they write and sign the will and interview them to see, are they aware who's the president, who's the governor, or what's going on today, who are your children, why are you doing this, what is your rationale, whatever, to determine what's happening, you see. And when the big case about this recently was Tom Benson. What should have been done was that they should have brought someone in to make that kind of determination before he made the changes in his will. So, to see, which should give a lot of credence and help a lot in determining whether or not what he's doing or saying, if he gives a reason, whatever the reason, as long as it's rational and it's based on reality, is good enough. But if he said, because the little green men tell me that I'm going to be beat up if I don't do this, then we look at maybe he's not competent to make that will.
Yeah, the purple men are always right, though. I know that. But you're listening to A Pause for Thought. We're having a very interesting talk with Dr. Tom Hannie, a psychologist of many facets. We have a couple minutes left if you'd like to get a call in, 343-9927, 343-9927. Johnny, anything to close out with?
Well, everybody hears about capital cases where murder is involved and where the death penalty is considered. And I know we don't have a lot of time, but we all hear about IQ tests. We hear about the perpetrator's past. Can you tell just a little bit about how you evaluate the competency of a person when they're faced with a death penalty?
Well, it's the same thing.
Okay.
I want to look and see, is he mentally retarded? To what extent is he mentally retarded? How well does he function? In this case, maybe I have to interview people that care for him daily. He's acting like he's very crazy. He's acting like he doesn't know what's going on. Does he know what's going on on the cell block? How does he interact with the people? The guy that's supposed to be mentally retarded and can't face the death penalty, is he a leader on his block? Is he responsible? And we see that.
Okay, one follow-up real quickly here. Trying children or trying minors as adults. Can you just give your quick opinion on that? We really don't have time for an in-depth analysis.
There comes a time when I think that maybe that's needed. I don't, it's really outside of my field. When I'm working as a forensic psychologist, I'm looking at the law. I'm not looking at making the law. And that's not my responsibility. Now, I get called in. I've done a lot of work with the Louisiana legislature in dealing with the laws and how they work and ways to help them to draw up the law. But I can't do that when I'm seeing a case. I have to obey the law.
I understand. Okay, well, that's about it for tonight. You've been listening to A Pause for Thought on WHYR LP in Baton Rouge, 96.9 FM. This is Wayne Parker signing off, and thank you for listening.